Hi and welcome. Today we're going to be talking about genital HPV and genital warts. Although most of this information can be applied to anyone with genital warts, we're going to be specifically focusing on women and other people with female genitalia. Human papillomavirus, or HPV, is a family of viruses. 40 of the more than 100 strains of HPV can affect the genitals. There are two types, HPV 6 and 11, that cause 90% of genital warts infections, but these types rarely cause cancer of the cervix, vulva, vagina, or uterus. HPV can be transmitted via skin-to-skin contact when active lesions are present, or through fluids during sexual contact. Almost all sexually active people will become infected with HPV at some point in their lives, and there are up to 6 million new cases per year in the United States. Most people with HPV are asymptomatic. People with genital warts have bumps or lesions on the vaginal introitus, the perineum, the vulva, the vagina, the anus, or the cervix. HPV lesions are generally painless. However, if they become inflamed or enlarged, they can become uncomfortable. Sometimes lesions are too small to see without a microscope. They are soft, swollen areas that can be dome-shaped, pedunculated, cauliflower-like, or flat, and they can occur singularly or be clustered or form plaques. Other less common symptoms include pruritus, vaginal discharge, dyspareunia, and postcoital bleeding. A diagnosis of genital warts does not require additional HPV DNA testing or expedited cervical cancer screening. In accordance with the general Pap test and HPV DNA testing guidelines, only perform an HPV DNA test if a client is aged 21 to 30 with an ASC US Pap test, meaning atypical squamous cells of undetermined significance, or if the client is over age 30 with a Pap test as part of normal cervical cancer screening. The primary reason for vaccination against HPV is to prevent the development of cervical cancer. However, 2 of the 3 currently available vaccine series also prevent the types most likely to cause genital warts. Vaccines are given as a 3-vaccine series over the course of 6 months to a year. HPV testing before vaccination is not necessary. Vaccination is recommended for girls ages 11 to 12, although they can also be administered to clients up to age 26 who have not yet completed the vaccination series. Treatment for genital warts is not intended to eliminate HPV, but rather to relieve symptoms, including lesion presence. Some clients may choose not to undergo treatment. Untreated lesions may remain the same, disappear on their own, or become larger and more numerous. All currently recommended treatments are effective. A regimen should be chosen based on individual client preferences, cost, insurance coverage, and convenience. Client-applied treatments are often more convenient. Podophylox solution or gel is applied 2 times a day for 3 days, with 4 days off, and then repeated for 2 to 4 cycles. Imiquimod cream is applied 3 times per week for 16 weeks. Cytokines ointment is applied 3 times per day until warts are gone. Clinician-administered treatments include cryotherapy using a cryoprobe or liquid nitrogen, tri- or bichloroacetic acid administered each week, and surgical removal using several techniques. There are also several other treatment options which may be appropriate in certain cases. All sexual partners of people with genital warts should be assessed for genital warts by their own healthcare provider. HPV testing is not necessary, although testing for other STIs is recommended. Condoms or other applicable barrier methods should be used until all partners are symptom-free and for 9 months afterwards due to the risk of subclinical HPV transmission. Remember that when lesions are present, HPV can be transmitted via skin-to-skin contact in areas not covered. It's important for clients to know that an HPV or genital warts diagnosis does not suggest infidelity. Certain lifestyle modifications can help reduce symptoms or prevent future genital warts outbreaks. Oatmeal baths, maintaining dryness and cleanliness of the affected area, and wearing cotton underwear or loose-fitting clothing are all helpful in symptom reduction. Healthy eating, sleeping well, exercising, and reducing stress will all help prevent lesion appearance. Clients who are smokers may wish to consider quitting smoking. A diagnosis of HPV or genital warts does not affect female fertility or the ability to carry a successful pregnancy. Vaccination is contraindicated in pregnancy, but vaccines can be given while breastfeeding. Some genital warts treatments are appropriate in pregnancy, but do not use podophyllin, cytokines, or imiquimod. Even if the birthing parent has current genital lesions, a cesarean birth is not warranted unless they occlude the vaginal opening. The risk of transmission to a newborn during birth and potential resulting development of respiratory papillomatosis is extremely low. I hope this information was useful. Let's work together to reduce the stigma around STIs.